Welcome back, everyone. Dr. Tony Ferretti talking about personality disorders. So today we're going to focus on histrionic personality disorder. Now remember, personality disorders typically start during early adulthood. They may appear at adolescence, but typically they really emerge during early adulthood. And remember what I've said before, that there's two parts to the cause of personality disorders. One is nature, genetics, and the other is nurture. So nurture can be learned behavior, environmental factors. So for histrionic, it's typically that they grew up with in an environment where the attention that they received from their family, their parents in particular, may have been unpredictable. So maybe they were striving to get that attention, to get that approval. Because histrionic personality types really crave attention and approval. Now, histrionic people, you might recognize a lot of actors and actresses being histrionic. It means they have excessive emotional expression. They tend to be dramatic, and they tend to focus on superficial things, like physical appearance is very important to a histrionic person. They also have a hard time forming deep, intimate relationships and connection because they love novelty. They love newness, and they get bored easily. So histrionic personalities, it's not horrible to have some of these characteristics, especially because they can be very likable, a lot of fun at parties. They have an easy time relating to people. However, in forming deep, committed relationships, they may have a harder time. Their behavior can sometimes be risky, and they may step out of a relationship or a marriage. They can be seductive, charming, but also provocative in the way they dress and in the way they act. They can use their attractiveness to manipulate others, which can be a real problem in a committed relationship. So what do? How do you deal with a person like that? Well, the first thing is psychotherapy. And I've said this before, for personality disorders, psychotherapy is typically the treatment of choice. Now, medication can help if a person has depression or anxiety on top of the personality disorder, which many people do, and sometimes people have an addiction as well. So medication can help with that, but to really treat personality disorders, psychotherapy is the treatment of choice. Now, different forms of psychotherapy I've mentioned before, but with histrionic personality, it's going to be really important that you help the person be more aware of how they come across. Be more aware of their verbal and nonverbal communication, because maybe they don't think that it's problematic. They don't think that their behavior is either inappropriate or seductive or flirtatious. They're unaware of that. So raising their awareness is an important part of the therapy process. Helping them do a better job at setting boundaries, because maybe they don't set good boundaries with the people around them. Helping them to communicate directly and effectively, and also taking responsibility for their actions. Now remember that with personality disorders, it seems that as a person gets older, the intensity of their symptoms declines. But there still are things that one can learn through psychotherapy, through working with a therapist, about themselves, and be more cognizant of the way they impact the people around them. So for people that have this personality type and want committed relationships, deep relationships, long-term relationships, it's going to be important that you work on the way in which you come across, the way in which you express yourself, and learn some skills and strategies to communicate more effectively, and not be so fixated on physical appearance, on attention, and also to work on being less sensitive to other people's comments or feedback. All of these factors and all of these strategies can help. So if you have any aspect of this, you may want to just take a look at it and look at what it is that you want to change about yourself. Until next time, Dr. Tony Ferretti.